Our next to last speaker is going to be Dr. Amanda Calhoun. And I am delighted to see that among our 276 listeners, Amanda's parents from St. Louis, Missouri are joining us. So you are all welcome. And Amanda, to you, please.
My name is Amanda Calhoun, and I'm an Albert J. Solnit psychiatry intern. I am also an activist, and I welcome you to this anti-racism space. But first, let me establish some ground rules. Rule number 1, I will not be talking about implicit bias. Not now, and not ever. Implicit bias is for your Statistics 101 course. Implicit bias is a sugar-coated and placating term for obtuse discussions and trainings. And frankly, it's been around for over 10 years. We tried that. It failed. Time to move on and start talking about the real issues. Anti-racism, anti-Blackness, white supremacy structures. Everyone suffers from implicit bias. Everyone does not suffer from systemic racism. Unarmed and innocent Black people are not murdered from implicit bias. They are murdered because of racist people in an intentionally racist system, a system upon which this country was built. Rule number 2, I will not be using the term people of color. There is a time and a place for that term, but that time is not now. I will be discussing the Black American experience, my experience, which is very different, both historically and currently, from the struggles of other minorities. And finally, rule number 3, you, members of the Yale Child Study Center, are my family. So I'm going to be honest with you. I have not felt safe discussing racism in the child psychiatry department, but I hope that will change. I hope that you are here today because the televised lynching of George Floyd showed you that racism is far from dead. I hope that you are here today because you want to listen and because you want to learn. I am the only African-American Solnit, and I'm aware of this all the time. Not just because I am often the only Black person in predominantly non-Black spaces, but because I am often the only one explicitly naming anti-Blackness and racism. And I often stand alone when I discuss the impact of racism on the very children we treat. Despite the fact that racism has documented effects on the physical and mental health of children, I often feel alone. I often feel isolated. I often feel unheard. I find it hard to focus on presentations that discuss the academic difficulties of a young Black boy without mentioning that Black boys as young as preschool age are 3 times more likely to be suspended for the same behaviors as their white peers. I find it hard to trust my attending when I bring up issues of racism, issues that my patients confided in me after the attending left the room, and that attending brushes off my concerns. I find it hard to trust my colleagues when they join in with the nurse making jokes that my young Black male patient wants to join a gang. And I find it enraging when I hear a senior resident tell my patient that they are paranoid. Paranoid when that little Black girl wondered whether the nurses were undertreating her pain and the doctors and neglecting her because of her race. Yet, the studies show that minority patients receive less empathy. Yet, the studies show that Black children receive less pain medication compared to white children for the same diagnoses. Yet, a 2015 survey showed that white medical students felt that Black patients had less sensitive nerve endings compared to white patients. Yet, it is documented that adults view Black girls as less innocent and less in need of comfort than white girls. And yet, the American Academy of Pediatrics recently released a policy statement naming racism as a social determinant of health and a driver of health inequities. At first, I expected to be congratulated for bringing up these studies, for giving enhanced insight into the lives of our Black patients. But instead, I was often met with silence, and sometimes with frank disapproval, with denial, with fragility. And because of this common response, we as Black people don't trust you when it comes to talking about racism. Your Black child patients don't trust you when it comes to talking about racism. And their Black parents don't trust you when it comes to talking about racism. And why should they? Why should I? Why would I tell you about the countless times fellow doctors have assumed I'm the janitor, even when I'm wearing a long white coat? Why would I tell you when I get a phone call from my mother that my autistic brother has been thrown on the ground and handcuffed? Why would I tell you that I worry every single day for my Ivy League trained physician father when he goes on walks in his own affluent neighborhood because he has been stopped by the police countless times? Why would I tell you that I wonder every day if my uncle would be alive had he been given a COVID-19 test instead of being turned away? Why would I tell you that I wonder every day if he would have survived if his skin color were different? Because the studies show that Black patients are less likely to be referred for testing compared to their white peers. I don't tell you. I smile, I nod, and I tell you all what you want to hear. But let's try something new. I want to break down the wall between Black people, including Black children who are reminded of their race every single day, and non-Black people who have the luxury of pretending to be colorblind. I want to start discussing racial disparities in the context of the racist systems that produced them. I want to be able to discuss racism that my Black patients share with me without fear that I will be dismissed or silenced by my superiors. I want us as child psychiatrists and child mental health professionals to start talking about racism with our Black patients. And I want you as child psychiatrists and mental health professionals to help me protect our Black children from racism. Thank you.
Thank you.